discuss megaloblastic anemia with the case-based question. So here that is patient, here that is presented with a physician that is with mark, fatigue, nausea with occasional diarrhea and a sore and swollen tongue. Lately he also has been experiencing a tingling sensation in his toes and a feeling of clumsiness. Microscopic examination of a blood sample indicated a reduced number of erythrocytes, many of which are megaloblasts, and a reduced number of leukocytes, including many large hypersegmented cells. Hemoglobin and serum levels of vitamin B12 were below normal. Additional tests confirm Pernicious anemia. So therefore that we can relate all the above manifestation and all the symptoms of the patient with respect to this pernicious anemia. So but before discussing pernicious anemia, you should know what is the normal metabolism of vitamin B12. So friends, so this is a normal metabolism of vitamin B12. So we are going to understand this with the help of a diagram also. So let's bring the diagram. So this is a diagram. So see that. So here that this is the vitamin B12 and this is a binding protein. So in our diet that is vitamin B12. So here binds with this binding protein. So it is present in the form of complex, basically vitamin B12, a binding protein complex. Now here that this complex passes through the mouth and also through the pharynx and also through the salivary gland. And this salivary gland, so here secretes saliva, and this saliva so here releases a protein that is heptocorrin or R-binder protein. So see that in pharynx that this heptocorrin protein does not bind with this vitamin B12. It only passes simultaneously along with the complex vitamin B12. That's all. So see what I've written. So in diet that is vitamin B12 is present in the form of vitamin B12 binding protein complex. Now here in salivary gland that is a vitamin B12 binding protein complex passes through a salivary gland. Now here in saliva, so here the saliva secreted by the salivary gland, and the saliva contains heptocorrin protein, and in pharynx the heptocorrin protein does not bind with the vitamin B12. It only passes. Now let's discuss about the case of stomach. So here see that this is the stomach. So here you know that in stomach that is gastric parietal cell is there, and this gastric parietal cell secretes intrinsic factor and HCl. And you also know that this HCl so here causes the formation of pepsin, and see that this pepsin so here that is breaks the vitamin B12 and binding protein complex. As a result vitamin B12 and that is a binding protein, they are separated. Now that this vitamin B12 so here binds with this heptocorrin to form that is heptocorrin a vitamin B12 complex. So this is the event of here. See that is gastric parietal cells and chief cells present in stomach, and this gastric parietal cells secrete intrinsic factor and hydrochloric acid, and this so here chief cells secrete a pepsinogen, and this pepsinogen is inactive but it is converted into active form by the acid HCl acid. So therefore that I said that is HCl causes the formation of pepsin. Now see that this is a vitamin B12 a binding protein complex. This passes through the pepsin, and this pepsin so here breaks this complex, so it separates or it frees vitamin B12 from the binding protein. So therefore that is pepsin causes the breakdown of the complex vitamin B12 binding protein to free vitamin B12. Now again I mentioned that is vitamin B12 so here binds with the heptocorrin in stomach. So see that this is the vitamin B12 and this is the heptocorrin. So that in stomach that is vitamin B12 so here binds with heptocorrin. Now here again that is so here vitamin B12 heptocorrin complex passes through the so here that is duodenum, and then it comes into the ileum. Now here see that this is the pancreas, and this pancreas releases an enzyme, basically protease enzyme. Now here see that this is a terminal ileum region. Now here that in this terminal ileum that is vitamin B12 and heptocorrin protein complex is there. Now due to action of this protease you can see that this again that this heptocorrin protein gets separated from the vitamin B12, because this is the vitamin B12 and this is the heptocorrin. Now again, after being separated from this heptocorrin, a vitamin B12 complex, that is vitamin B12, so here now binds with this, so here intrinsic factor, because this is the intrinsic factor. Now it forms, so here basically that this intrinsic factor vitamin B12 complex. Now that this intrinsic factor vitamin B12 complex binds with the intrinsic factor receptor to cause the final absorption of vitamin B12. So see that, so here pancreas secretes protease enzyme. So see that in terminal ileum, that is in terminal ileum, the enzyme protease acts on the complex vitamin B12 heptocorrin to free vitamin B12, and then this vitamin B12, so here vitamin B12 and heptocorrin protein, so here is separated by the protease enzyme. So simple. Now here that is vitamin B12, so here binds to the intrinsic factor to form vitamin B12 intrinsic factor. So therefore I written that vitamin B12, so here binds to intrinsic factor to form, so here vitamin B12 intrinsic factor complex. Now that is vitamin B12 intrinsic factor complex binds to intrinsic factor receptors to cause absorption of vitamin B12. So in this way vitamin B12 is absorbed. Now here from terminal ileum it is transported by this transcobalamin, so here to different sites where the vitamin B12 is required. So now you have understood that, so here normal, so here absorption of vitamin B12, but for metabolism, so here like that functions, how vitamin B12 is used. So here functions of vitamin B12 first in erythropoiesis. So here in erythropoiesis, that is vitamin B12 and folic acid are required for DNA synthesis. And how? Because deoxyuracyl monophosphate converted to deoxythymidine monophosphate, and then this thymine, so deoxythymine monophosphate, so here does the, so here a DNA synthesis. So therefore that I have written that, and also that this DNA synthesis, and this is very essential, so that in erythropoiesis, that is there is nuclear and cytoplasm synchronicity. That means the synthesis of nucleus as well as that of cytoplasm, so here that is take place simultaneously in a balanced manner. So therefore I written that due to the above following mentioned process, the required nuclear and cytoplasmic synthesis go in a parallel balanced manner simultaneously. So this is the first function. Now the second function, yes, and the importance of the first function is that if you see that the size of the mature RBC as compared to the precursors, that it is less, and also from the precursors to the mature RBC, as the formation goes on, the size goes on decreasing. Why? Because of this nuclear cytoplasmic synchronicity. Now here and again, that is vitamin B12, so here essential for synthesis of neuronal lipids. And how that is, it causes the synthesis of neuronal lipids, that is methyl malonyl coenzyme converted to succinyl coenzyme by the enzyme vitamin B12, and this succinyl coenzyme required for neuronal lipid synthesis and myelin sheath formation. See this. So a neuronal lipid disease, and this is myelin sheath formation. And CNS, that this myelin sheath has a very important role, and for the formation of neurons also, that is a very important role. Now here and again methionine synthesis, and also for the that is formation of active form of folic acid. That this vitamin B12 causes the conversion of homocysteine to methionine, as well as from the methyl tetrahydrofolate to active form of tetrahydrofolate. That's all. And due to this, so here homocysteine level decreased. So these are the important functions. So these are all important functions and the normal events for the vitamin B12. Now here pernicious anemia, it is an abnormal condition. So now here basically what happens is that in pernicious anemia, autoantibodies against the gastric parietal cells or intrinsic factor receptors male. As a result, what happens is that, see, so as I already mentioned that in the metabolism, that is gastric cells, so here secrete intrinsic factor and hydrochloric acid. Now see that As already mentioned, that autoantibody is made against the gastric parietal cells, so therefore that is gastric parietal cells inactivated, so therefore that the required synthesis of intrinsic factor is not done, and you know that this intrinsic factor necessary for the vitamin B12 absorption, as a result that this vitamin B12 absorption is also affected because the intrinsic factor is secreted either less or it is not secreted. Now again, now I also mentioned that is autoantibodies made against the intrinsic factor receptors. So see that is vitamin B12 and intrinsic factor complex binds to intrinsic factor to cause the vitamin B12 absorption. But in case of pernicious anemia, that is autoantibodies made. So therefore that autoantibodies, so therefore intrinsic factors affected, so therefore vitamin B12 absorption is also affected. So this is the case of pernicious anemia. So therefore that in pernicious anemia due to autoimmune response, vitamin B12 absorption is affected. So now let's discuss about the symptoms or the clinical features found in the patient. So see that this patient, so here that is lately he has also been experiencing, so here tingling feeling, so here tingling feeling in his toes and a feeling of clumsiness. So now here basically why does the patient feel this? So as you already know that this methylmalonyl coenzyme is converted to succinyl coenzyme by the vitamin B12, and this succinyl coenzyme is necessary for neuronal lipids and myelin sheath formation. Now this is a normal situation, but you know that this in pernicious anemia that is vitamin B12 is not absorbed. Now due to the absence of vitamin B12, what happens is that no vitamin B12, no succinyl coenzyme, so therefore neuronal lipids and myelin sheath synthesis of neurons are affected. As a result, so here neurologic manifestations occur, and due to this neurologic manifestation, so here basically tingling sensation and feeling of clumsiness occur in the patient. So therefore that I written that, so here due to neurologic and manifestations, tingling sensation occurs. Now so here sore, swollen tongue, why does it occur? Now so the also normal situation is that on the tongue surface, so here cell division is occurring and for a vitamin B12 required. Now as I already mentioned that in pernicious anemia no vitamin B12, no proper cell division, atrophy, so therefore that is sore, swollen tongue, that is glossitis. See, so this is the image of glossitis. See that is a tongue has become that is red beefy bulb, that's the reason because of the absence of vitamin B12, glossitis. Now here again fatigue. So here fatigue, it is a common symptom that it occurs in every anemia, all types of anemia, and this fatigue occurs because there is less hemoglobin, so therefore less oxygen, so therefore less energy, because you know that oxygen is required for energy generation. Now so by seeing the tingling sensation of the patient and this sore, swollen tongue, glossitis, that is we can go towards the megaloblastic anemia, and also by seeing the fatigue. But it doesn't mean that by seeing the fatigue that is we can surely that is assume that the patient has megaloblastic anemia, because that is this fatigue occurs in all types of anemia. Now here nausea with diarrhea. So therefore as you already know that antibodies made against the gastric parietal cells, and due to the so here affection of the gastric parietal cells, digestion affected, and also neurological symptoms found, and due to this neurological symptoms and digestion affection, that is nausea with diarrhea occurs. So these are the explanation of the clinical features or the symptoms found in the patient. But now that is now to the lab investigations that we have been found a reduced number of erythrocytes, and many of which are megaloblasts, and reduced number of leukocytes also. Why? And many of which are hypersegmented cells. Now I'm going to explain this region. So now see that, and now here why megaloblast and reduced number of erythrocytes occur. Now so friends, first of all see this image. So if you see that, now here you can notice that as the formation of mature RBC is taking place from the proerythroblast, the size of the erythroblast goes on decreasing. Why? Again, because of nuclear cytoplasmic synchronicity. And therefore basically all these are basically normoblast, early normoblast, intermediate normoblast and late normoblast. So here basically precursors of RBC are known as normoblast. But as I already mentioned, that is vitamin B12 is necessary for DNA synthesis, and due to this nuclear cytoplasmic synchronicity occurs. Now, if no vitamin B12, no DNA synthesis, then this nuclear cytoplasmic synchronicity will not occur. Now, due to this, what will happen is that basically that this nuclear synthesis will lag behind. As a result, the size of all the precursors of RBC will be larger than the normal. As a result, that these precursors will be now called megaloblast. See that no vitamin B12 absorption, no DNA synthesis, so therefore maturation of cytoplasm and nucleus don't take place simultaneously. So therefore nuclear cytoplasmic asynchronicity occurs, and due to this, so here precursors of erythrocytes are larger than normal, therefore these are known as megaloblast. Now, and these megaloblasts, they are released in the blood, and also that due to this nuclear cytoplasmic asynchronicity, maturation arrest, and due to this maturation arrest, the mature form of WBC, RBC and platelets not synthesized, and as the mature form of RBC is not synthesized, so therefore reduced number of erythrocytes occurs. Now again similarly due to that region also, so here that is mature form of WBC is not occur, and this is explained here. See there, and this leads to formation of hypersegmented neutrophils. That is, hypersegmented neutrophils are the immature neutrophils having lobes 6 or greater than 6 lobes, and you already know that this neutrophil is also a WBC, basically leukocyte. That's all. And also, and you already know that in case of anemia, basically hemoglobin level is low, and also, and due to this pernicious anemia, that is in patients serum levels of vitamin B12 are below normal, so this causes the deficiency of vitamin B12, and due to deficiency of vitamin B12, so a tingling sensation, that is tingling sensation occurs due to deficiency of vitamin B12, and also, so here a sore and swollen tongue, basically glossitis occurs, and also, so here megaloblast found in a lab diagnosis and hypersegmented, so here cells found. So these are all the, so here cases or clinical features that move towards the megaloblastic anemia case. That's all.